Welcome to Health Stealth Radio, where we move away from the mundane to gather insights from the shadows of enterprise and patient cybersecurity. Yes, we surely believe that traditional themes like endpoint software and zero trust are critical, but given massive advances in AI, remote and wearable device hacking, and data hostage negotiators, there's a much darker side to cybersecurity, and not everyone is quite willing to talk about it in public. Health Stealth Radio will thrive on these topics and encourage fireside spats to debate them. Here's your host, Frank Cutitta.
This is Health Stealth Radio, and we have the opportunity of broadcasting from the ViVE conference here in Los Angeles. And an old friend and a professional colleague, Jaydeo, is running a new and exciting company that has to do with nudging technology. Now, just as a little bit of a walk down memory lane, Jaydeo was a pioneer in the hospital at home business, and that's where we first met. So I will, at the end of this, sort of be curious to get his insights about where that market has gone. And he's now moved on and has a number of projects and growth projects that he's working on right now that we want to talk about, especially the nudging technology. So without further ado, Jaydeo.
Thank you, Frank, and pleasure to be here with you. Big fan of the work that you do and insights that you bring to the community and network. I think it's been fascinating 2 days here at ViVE. I think a lot of energy and a lot of inspiration with new innovative ideas. A little bit about myself quickly. I've been building digital health solutions businesses for several years with large companies such as GE, Philips, Best Buy Health, as well as working closely with startups that are backed by VC and PE firms as well. And I built solutions around telehealth, remote patient monitoring, patient engagement solutions, selling to providers, payers, personal emergency response services, as well as acquired startup companies and built new ventures as well. Since last year, I've been working with different companies that are really trying to bring a new way to understand an individual at a personal level. And one of the challenges that is very dominant in healthcare today is we have one-size-fits-all type of a challenge, where the last 100 years were spent in healthcare trying to standardize the care model. I think the next 100 years are really going to be spent on trying to personalize the care model at every aspect, every dimension of healthcare. And I think that's what I would love to talk to you about, and some of the exciting technologies and patient experiences that are coming to the market. But I'm happy to be here. And
yeah, I mean, it's curious to see what just the thought of the next 100 years will be. But I mean, it's that the future is not evenly distributed, so a lot of things could happen in a relatively short period of time. So tell me a little bit about the technology and what the purpose is, especially as it relates to behavioral health. Obviously, that's the largest part of it, but there are so many subsets of behavioral health. And as I understand the technology from a brief description you gave me, it's able to sort of personalize these nudges based on the behaviors or lack thereof that you're doing in your life.
Exactly. I think one of the challenges that we have in healthcare is human beings are irrational. And, you tell a congestive heart failure patient not to eat barbecue chicken pizza, and that person will eat and end up back in the hospital. And so I think what is not working is the standard boilerplate way of sending same message to 100,000 patients, telling them to walk few steps more, telling them to manage nutrition, or telling them to take their medication. The behavior science with a combination of AI, ML technologies has matured enough where companies like QZen are now combining the AI, ML, and behavior science to really create personalized nudges that understand you as a Frank, what are your individual preferences, understands you as your daily healthy habits, health data, and combines the SDOH data, claims, EMR data to really create a digital twin. So it keeps learning and adapting about you, just like a Netflix engine, right? So Netflix understand what type of genre you like to watch, at what time do you watch, and it will keep learning. So similar to that, the AML technology really uses the Fitbit, Health, Apple Watch, different trackers data to keep learning about you. And so if you take a step back, I think gone are the days when you force a patient or a member to do certain thing to drive compliance or adherence with a care protocol or medication adherence. I think back by the nudge theory, by the way, there was a Nobel Prize that was given to Professor Thaler back in 2007, and he wrote a book called The Nudge Theory, right? It's based on a choice framework and how you can influence the choice of an individual based on the options you provide. And you probably have seen some of the YouTube and TikTok videos, right? When people are given a choice to, climb up the stairs versus an escalator, how do you nudge them to take stairs and walk steps versus an escalator, right? So some of that theory has been really brought to healthcare, where if I can understand Frank is likely going to respond at 4 o'clock in the afternoon to a nudge versus 8 o'clock in the morning when maybe he's getting ready to go live on the radio. Frank is likely going to respond to educational content versus inspirational message, so understanding the tonality. And then really learning like a Netflix engine so that you start personalizing to an extent where you understand Frank not as a patient or a member of a health plan or a clinical trial, a member or a subject, but as an individual. So you understand Frank is going to respond through in-app notifications and nudging versus a phone call or a SMS. So this is about personalizing the patient engagement or a member engagement, whether it's for driving medication adherence, whether it's for driving member enrollment and engagement, or any chronic condition management where you're trying to get a patient to adhere to a care protocol.
Interesting. Are there any counterintuitives that you've bumped into about how people prefer to get their nudges, whether it be watch, phone, whatever it could be, on the TV screen? I don't know.
Yeah, it's fascinating. So one of the customers this company Cuisine has is in Singapore with Ministry of Health. They have 70 different health programs on the platform and 3 million Singaporean patients on the platform who are receiving millions of nudges every day. And there are fascinating insights and nuances about the patients who are on a certain brand wearables. Think about like an Apple Watch versus Fitbit versus Samsung versus Garmin. And their behavior actually tends to be different. So it's not only demographics versus individual preferences and where they live and what zip code they live in, but the choices they make as a consumer are also being translated into how they adhere to a care plan or a protocol. But with the nudging technology, we're able to actually get 3x engagement, so we're able to get people walk 30% more, exercise 15% more. And as you know, the more you walk, the more exercise you take, for example, it starts reducing your cardiovascular risk, mortality risk, cancer risk. I think one of the challenges that we have in the healthcare today is we're all looking at a patient through silos. So a diabetic management company is looking at a patient only through diabetes lens. A payer is looking to drive a smoking cessation program, for example, for the same patient. And there might be a PCP who is trying to drive a hypertension program for the same patient.
Right.
And all of them are bombarding the patient with so many different messages. The AI ML is actually able to take all of those programs and optimize the care pathways and figure out what is the next best action to nudge the patient on the next step. And so I think that is becoming also effective, where you are now orchestrating multiple health goals, wellness goals, and chronic condition management goals.
So let me ask you a question. So if I'm constantly getting nudges on this for one thing or another, stand up. Will the software, if I'm using an Apple Watch, will it override the nudges that I'm currently getting and filter out only the ones that are the most critical to my behavioral health?
Yeah, great question, right? So the nudges you get on Apple Watch or any smartwatch today are what I can call as like a just in time, right? So it's asking you, hey, stand up. You haven't stood up for 1 hour. So it lacks the longitudinal context today. It doesn't know who you as a patient, as a member, as an individual, what is your goal for next 3 months or 6 months. So that's major difference, right? So the AI ML engine is going to personalize your goal and nudge you over the period of 3 months, for example, towards your goal. But the flexibility is there. So when the customers can create a program, they can choose how the nudges are delivered. And it can be a combination of native nudges from a smartwatch, or user might say, I prefer my nudges in-app notification or a phone call. And so all of that can be configured to individual preferences.
So you sort of brought it up in a different way, and for lack of a better term, the social determinants of nudging. So, I mean, obviously, we have the haves and the have-nots, and some of the people that need nudges more than others are, here I go, I'm being nudged. Some of the people that are that need it the most are the ones that have the least access to a fancy watch or something like that. Is that part of the product strategy that you have, is to make sure the people that need it the most are able to get the tech to do the software capabilities?
Absolutely. So there are a couple of ways through which this is being addressed. First of all, a nudge is not only a text message, right? So a nudge can be a in-app notification. So if you have a smartphone, it can be a notification within the app that you might be using to manage your own diabetic program, for example. A nudge can also be a survey that is sent to a patient, or a nudge can be a phone call as well. So if you're living in a rural part of America and you don't have access to a smartwatch or maybe a smartphone, a regular landline phone can be used.
Sure. How about a voice-enabled device like an Alexa or something like that?
Absolutely.
I would think so, yeah.
But then what they did in Singapore, Frank, was the government actually came out with a program where they gave free fitness trackers to all of the citizens of Singapore.
Which would be compatible with your product.
Exactly. And so then the Cusense engine has become a default engine to drive 3 million Singaporeans on the platform to their daily activities. And so this is where in the US market, if you're an employer or if you're a health plan and you want to drive towards a certain Medicare Advantage rating and score and star rating, and you want to make sure that you're driving members for basic compliance to screening, colorectal screening, mammography screening, for example. You are driving the patient engagement through sort of the chronic condition management program. Many health plans are now looking to offer some of these low-cost fitness trackers as a way to drive the engagement. But then the nudge doesn't have to be, so nudge can be through many different modalities and communication channel. The important thing is for the engine to keep learning what are your preferences, how you're going to learn and adapt, and make sure that we get the patient or a member towards a certain goal. So that whether it's a preventative screening for payers or for primary care companies, or it's a pharma trying to drive clinical trials compliance and adherence, or even a retail health pharmacy who is really trying to nudge their members/patients to pick up their prescriptions. Simple things such as that.
Just call it, I just got it.
There you go. Right? It's amazing how many people don't just pick up the prescription, right? So that's the thing. And I think that's where we have to humanize the technology, because technology itself is not an answer to everything.
Absolutely not. It's a problem, in fact. So one of the interesting sessions I went to today was talking about the obesity drugs and the whole chaos with these obesity drugs. I mean, a huge opportunity for people that are obese to lose weight, but at the same time, managing that and how they're distributed, and actually the technology you're talking about came up, how you just can't give people drugs, that you have to have a platform, and drugs are only part of it. And they were talking about the devices you're selling as part of that.
Though I think that's a great point, and I think we'll only find out over a period of time, right? How the GLP-1 and the drugs are really going to create a long-term sustaining outcomes. But even if you think about somebody who is pre-diabetic and you're trying to get that person to get into a normal zone, for example, or a severe diabetic person to come back into a normally managed diabetic zone, for two people you would be having two different clinical pathways. So one person you might be better off nudging them to walk 10,000 steps first, then lose weight, then manage nutrition sequence. For another person, maybe that person is going to be better motivated to manage nutrition first, lose weight, and then start getting to 10, 15K steps. So I think that's the beauty of personalization, where we, I think, need to go further and make sure that we are not running the same boilerplate programs across 100,000 patients the same way, but we are really taking it to the individual level and then automating at a population level.
So in your 100-year vision, it makes me wonder, I mean, this is obviously for patients, but I'm wondering, and maybe you're not wondering, you might do this already, if there's an application for clinicians. Because, I mean, first of all, I mean, there are behaviors that they need to change. Like, when I was in hospital, I'll be back in a minute. And a minute was, it was a figment of my imagination and theirs. But also just the fact that they're burning out and they're lonely and that they have these mental health things themselves, and thinking that there could be a device which, for the population that is most prone to alert fatigue, to give them a signal that's strong enough to say, here's the alert that you have to listen to.
100%, right? I mean, clinician burnout is a big challenge, and I'm so glad to see so many digital scribes coming onto the market. That's beginning to reduce some of the burden. But I think the nudging clinician is also the other side of this solution. Nudge them to manage their health in a better way, understand the stress markers. Also, on the other side, as you are trying to standardize the clinical practice, nudging physicians to make sure that they are prescribing the right therapy and right drugs is also one of the applications. So you have a large variation sometimes across a physician group, where even though for a certain diagnosis there is a certain standard medically guided therapy protocol, only 50% might be actually prescribing that therapy and drug to a patient. So how do you nudge them to make sure that they're actually adhering and complying to the standard of care, and then working with physicians on an individual level to make sure that, hey, 80% of your colleagues are prescribing these 3 drugs for this diagnosis. Are you sure you want to take a look at them?
Right. So this might be an obvious part of the product, but I mean, am I to understand that the primary care physician could get a log of the nudges that were sent out? Is that part of the dashboard?
Absolutely. The dashboard gives you very rich analytics and data at the population level as well as at the individual level. So you can exactly know which patient cohorts are moving towards a goal, which are not. You can re-stratify them based on demographics, clinical conditions, their behavior. And at the individual level, you can understand how they're responding to nudges, whether they're opening the nudges or not, and what interventions they're following based on the nudges as well.
Okay, so it's micro and macro. It's a population health product.
Exactly.
Okay. I just with the time we have left, we only have like 6 minutes, and I hope you don't mind I ask you a personal question based on something you said. You told me that since the last time I saw you, you brought your parents over from India to care for them. So as a guy who's worked in so many different aspects of the healthcare system, we all think that we're the smartest people on earth when it comes to healthcare, except when it's our parents. What are some of the things that you experienced when you brought your mom and dad over?
It was an eye-opening experience like anything. For somebody to come into a new country and experience a healthcare with language barriers and trying to manage multiple chronic conditions, physical therapies, trying to deal with insurance, it's almost unmanageable. And I just realized how much of empathy is needed in the health system to work with seniors, and then how much important is the role of a caregiver to really be that quarterback for your loved ones. And even I've been working in the healthcare technology space forever. even beyond technology, you still need that human touch. You need somebody who truly cares about you, who's going to identify the gaps, and who is trying to pull together a holistic plan driven by empathy to really get you to a life that you want to live. And it was hard. It was hard, Frank. I think me and my family had to make some tough choices to, take a break from a corporate career and make sure they settled down. It was worth it. It was something that I really felt I had to do. But in the process, it really opened up my eyes to think about, as you and I and all of my colleagues here at ViVE, we're all trying to transform healthcare, change healthcare. And in the process, we have to make sure that we don't lose that patient.
Did you find that there was I'm asking this for selfish reasons because I teach a graduate course at Northeastern in cross-cultural communications. Do you think there's a cultural intelligence gap when these people come over that's embedded in the healthcare system, despite the fact that it's incredibly diverse when you walk into a hospital with a number of nationalities and everything? But it seems to me that cross-cultural intelligence is lacking, mainly because it's not just because I don't know how to communicate with someone from India. It's because people in the care setting might be from China and India, and they can't communicate with each other at the clinical level. What was your experience?
Yeah, it's a huge cultural chasm that's tough to cross. And it's not just a language barrier, but it's also the practice of medicine. It's still fundamentally very different. The patient-physician relationship is different. And I think truly trying to go through assembly line process, sometimes in the US healthcare system, can be very daunting for especially people who are not used to the system.
Did you find, this might even be an improper question, but I'm going to ask it anyway, did you find that it was more comforting to have an Indian doctor as opposed to a Western doctor?
Definitely. And I think somebody who can relate to the background in which they grew up, understand their daily habits, including nutrition, which can be very different, and then being able to connect. Sometimes there are physicians who can speak.
Right. So in India, I mean, considering the number of dialects and number of cultures within India, this microculture aspect of it is critical. I don't know where your parents are from, but I'm sure somebody that had that geographic centricity.
Yeah, and we are fortunate to be in Boston, where there's a rich diversity of all different types of physicians coming from all different places and routes. It would have been a lot challenging if we were in a different part of the country with less diversity.
I wouldn't be alive now if I didn't live in Boston.
Boston rocks.
during 2020, it was just it was the place to be. Not even New York, we're all very fortunate that we have that level of care. It's always fantastic to speak with you, and it's not over. We'll have to do Act 2 as you start rolling this out, and I'm very curious about the findings, both from a technological point of view, data point of view, and the softer sides of this as well.
Would love to follow up. Thank you for the platform, and great to see you again.
Always here. Thank you.
Thank you for joining us today in the shadows for this episode of Health Stealth Radio with Frank Cutitta. If you like the program, please be sure to share your comments on our social media sites, or feel free to contact us with suggestions for new and stealthy show themes. We look forward to welcoming you again for our next broadcast. In the meantime, stay safe out there.